Hello, I'm Dr. James Wilson, and welcome to Senior Vitality Clinic. Have you ever left your cardiologist's office and realized you forgot to ask something important? Or maybe you felt rushed and didn't want to bother your doctor with questions. You're not alone. Studies show that patients remember less than 50% of what their doctor tells them during an appointment. Today, I'm going to give you 5 powerful questions that can help you get the most out of your next cardiology visit. These aren't just any questions. They're the ones that cardiologists wish more patients would ask, because they lead to better care and better outcomes. Whether you've been seeing a cardiologist for years or you're preparing for your first appointment, these questions will help you understand your heart health, your treatment options, and what you can do to live a longer, healthier life. By the end of this video, you'll know exactly what to ask, why these questions matter, and how to use the answers to take control of your cardiovascular health. I'll also give you a simple checklist you can print and take to your next appointment. Let's get started. Before we get to the 5 questions, let me explain why asking the right questions matters so much when it comes to your heart health. The reality of medical appointments. The average cardiology appointment lasts about 15 to 20 minutes. That's not a lot of time. Your cardiologist needs to review your medical history, check your test results, examine you, and make treatment recommendations. It's easy for important details to get missed. According to research published in the Journal of General Internal Medicine, patients who ask questions during their appointments have better health outcomes. They're more likely to follow their treatment plans, understand their medications, and notice warning signs early. It's why seniors need to be more proactive. After age 60, your risk of heart disease increases significantly. The American Heart Association reports that about 70% of adults aged 60-79 have some form of cardiovascular disease. These numbers climb even higher after age 80. But here's the good news. Most heart problems can be managed effectively when caught early and treated properly. The key is knowing what's happening in your body and working closely with your doctor. Common misconceptions about cardiology visits. Many people think they shouldn't take up too much of their doctor's time with questions. This is wrong. Your cardiologist wants you to ask questions. They want you to understand your condition. Good doctors know that informed patients do better. Another common mistake is waiting for the doctor to tell you everything you need to know. Doctors are good at explaining things, but they can't read your mind. They don't know what worries you most or what you've read about online that confuses you. You need to speak up. Some patients write off symptoms as just getting older and don't mention them. Shortness of breath when climbing stairs, fatigue that never goes away, or swelling in your ankles might seem like normal aging, but they could be signs of heart problems that need attention. What makes a question smart? A smart question is one that gets you information you can actually use, helps you understand your specific situation, leads to a conversation, not just a yes or no answer, helps you make better decisions about your health, gives you peace of mind. The 5 questions I'm about to share with you meet all these criteria. They're based on cardiology best practices and guidelines from the American College of Cardiology. A note about individual variation. Remember, every person's heart health is different. You might have high blood pressure, atrial fibrillation, heart failure, or you might be recovering from a heart attack or surgery. Some of these questions will be more relevant to your situation than others. That's okay. Use the ones that apply to you and feel free to adapt them to your specific needs. Question number 1. What is my actual risk of having a heart attack or stroke in the next 10 years? This is one of the most important questions you can ask, but most patients never ask it. Your cardiologist can calculate your cardiovascular risk using established tools like the ASCVD risk calculator. This gives you a percentage. For example, you might have a 15% risk of having a heart attack or stroke in the next decade. Why does this number matter? Because it helps you and your doctor decide how aggressive your treatment should be. If your risk is low, under 5%, you might focus on lifestyle changes like diet and exercise. If your risk is moderate, 5-20%, you might need medication plus lifestyle changes. If your risk is high, over 20%, you might need multiple medications and very close monitoring. According to the American Heart Association's 2024 guidelines, knowing your risk score helps you make informed decisions about medications like statins, blood pressure drugs, and aspirin therapy. Follow-up questions to ask. What factors are driving my risk up? Is it my blood pressure, cholesterol, family history, or something else? If I make lifestyle changes, how much could I lower my risk? How often should we recalculate this risk score? Here's why this matters. Two people can have the same cholesterol level but very different risk profiles. One might be fine without medication, while the other needs treatment right away. The risk calculation takes into account your age, blood pressure, diabetes status, smoking history, and other factors to give you a personalized assessment. Don't leave your cardiologist's office without understanding your risk level. This number should guide every decision you make about your heart health. Important note: talk to your doctor about what your specific risk score means for you. These calculations are tools, not crystal balls. They help guide decisions, but your doctor will also consider factors that don't show up in the calculator. Question number 2. Can you explain my test results and what they mean for my daily life? You've probably had tests like an echocardiogram, stress test, CT scan, or blood work. But do you really understand what the results mean? Many patients get told everything looks fine, or your numbers are a bit high, but they don't understand what that means for how they should live their life. Here's what you need to know. If you had an echocardiogram, your doctor can tell you your ejection fraction, EF. This measures how well your heart pumps blood. A normal EF is 50-70%. If yours is lower, you might have heart failure, and that affects what activities are safe for you. If you had a stress test, ask how far you went, what your heart rate was, and whether there were any concerning changes on the EKG. This tells you how much exercise your heart can handle safely. For blood work, don't just focus on your total cholesterol. Ask about your LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. Also, ask about your hemoglobin A1C, if you have diabetes or prediabetes. According to research in the Journal of the American College of Cardiology, patients who understand their test results are more likely to stick with their treatment plans and make necessary lifestyle changes. Follow-up questions to ask: are any of my numbers in a danger zone that requires immediate action? Which of my results should I track at home? How often do I need to repeat these tests? Are there any activities I should avoid based on these results? Practical tip: ask your doctor to write down your key numbers or print out a summary. Keep this information in a health folder at home. This becomes especially important if you need to see a different doctor or go to the emergency room. Remember, test results aren't just numbers on a page. They're a roadmap that shows you where you are now and where you need to go. Question number 3. What are my medication options, and what are the pros and cons of each? This question is critical because many heart medications have alternatives. You and your doctor should discuss which option is best for your specific situation. Let's say you need a blood thinner. There are older medications like warfarin and newer ones like apixaban or rivaroxaban. Warfarin requires regular blood tests and has more food interactions, but it's been used successfully for decades and has an antidote. The newer medications don't require blood tests and have fewer food restrictions, but they're more expensive, and some don't have antidotes. For high blood pressure, there are at least 6 different classes of medications. Some work better if you have diabetes, some are better if you have kidney disease, some cause a cough or ankle swelling while others don't. The American Heart Association emphasizes that medication decisions should be personalized. What works well for your neighbor might not be the best choice for you. Follow-up questions to ask: what are the most common side effects of this medication? Are there any foods, supplements, or other medications I should avoid while taking this? What should I do if I miss a dose? Is there a generic version available? How will we know if this medication is working? What are the warning signs that this medication isn't right for me? Important cost consideration. If cost is a concern, tell your doctor. There's no shame in this. A medication you can't afford won't help you. Your doctor can often prescribe an equally effective but less expensive alternative, or help you find patient assistance programs. According to a 2023 study in Circulation, up to 30% of patients don't take their heart medications as prescribed, often due to cost or side effects. Don't let this be you. If you're having problems with your medications, speak up. Safety reminder: never stop taking heart medications without talking to your doctor first. Suddenly stopping certain medications, especially beta blockers or blood thinners, can be dangerous. Every medication decision involves weighing benefits against risks. Your doctor can't make the best recommendation without knowing what matters most to you. Question number 4. What lifestyle changes will have the biggest impact on my heart health? 375 words. This might be the most important question of all because lifestyle changes can be as powerful as medications, sometimes even more powerful. But here's the problem. General advice like eat better and exercise more isn't helpful. You need specific, personalized recommendations. Let's get specific. Instead of asking, should I exercise, ask, given my current heart condition, what type of exercise is safe for me? How many minutes per day? At what intensity? Are there any warning signs I should watch for? For many people with stable heart disease, the answer might surprise you. Research published in the European Heart Journal shows that moderate exercise, even just 30 minutes of brisk walking 5 days a week, can reduce cardiovascular risk by up to 30%. Instead of asking, should I change my diet, ask, what specific dietary changes would help my particular condition most? Should I follow the Mediterranean diet, the DASH diet, or something else? Should I limit sodium? How much? If you have heart failure, limiting sodium and fluids might be crucial. If you have high cholesterol, focusing on fiber and healthy fats matters most. If you have atrial fibrillation, you might need to be careful with alcohol and caffeine. Other lifestyle factors to discuss: sleep. Poor sleep and sleep apnea increase heart disease risk significantly. Stress management. Chronic stress affects blood pressure and heart rhythm. Smoking. If you smoke, quitting is the single most important thing you can do. Alcohol. How much is safe for your specific condition? Weight. If you need to lose weight, what's a realistic goal? Follow-up questions. Should I see a cardiac rehab specialist or nutritionist? Are there any activities I should avoid? How will we measure if these changes are working? According to the American Heart Association, combining medication with lifestyle changes is far more effective than either approach alone. But you need to know which changes will help you most. Talk to your doctor about creating a realistic, specific action plan that fits your life and your goals. Question number 5. What warning signs should I watch for, and when should I call you versus going to the emergency room? 350 words. This question could save your life. Many people wait too long to seek help because they're not sure if their symptoms are serious. Others rush to the ER for things that could wait for a regular appointment. You need to know the difference. Symptoms that require calling 911 immediately. Chest pain or pressure that lasts more than a few minutes. Shortness of breath that's severe or sudden. Pain that spreads to your arm, jaw, neck, or back. Sudden weakness or numbness on one side of your body. Sudden confusion or trouble speaking, fainting or near fainting, especially with chest pain. Rapid or very irregular heartbeat with dizziness or chest discomfort. Don't wait. Don't drive yourself. Call 911. Symptoms to call your cardiologist about within 24 hours. Swelling in your legs or ankles that's new or getting worse. Weight gain of 3 pounds in a day or 5 pounds in a week if you have heart failure. Increasing shortness of breath with activities you used to do easily. A cough that won't go away, especially at night. Feeling more tired than usual. New irregular heartbeat that comes and goes. Ask your doctor. Are there specific symptoms I should watch for given my particular condition? What changes in my symptoms should prompt me to call? What's the best way to reach you or your office for urgent concerns? Do you have an after-hours number? Should I use a patient portal to message you? According to the American Heart Association, knowing when to seek emergency care for heart symptoms is crucial. Time matters. Getting treatment quickly for a heart attack can prevent permanent damage to your heart muscle. Write this down. Keep a list of warning signs on your refrigerator. Make sure your family members know them too. They might notice symptoms you don't. Talk to your doctor about creating a personalized symptom action plan. This should spell out exactly what to do and when. Now that you know the 5 questions, let me give you practical tips for making your next cardiology appointment as productive as possible. Before your appointment, 1. Write down your questions. Don't trust your memory. Bring a list. 2. Update your medication list. Include prescription drugs, over-the-counter medications, vitamins, and supplements. Include doses and how often you take them. 3. Track your symptoms. If you've been having chest pain, shortness of breath, or other symptoms, write down when they happen, how long they last, and what you're doing when they occur. 4. Bring recent test results. If you've had tests done elsewhere, bring copies or make sure your cardiologist has them. 5. Bring a family member or friend. 2 sets of ears are better than 1. They can help you remember what the doctor says and ask questions you might forget. 6. Check your insurance. Know what your plan covers so you can discuss testing and treatment options realistically. During your appointment. 1. Speak up early. Tell your doctor right away if you have specific concerns or questions. Don't wait until you're being walked to the door. 2. Take notes or ask if you can record the conversation on your phone. You won't remember everything. 3. Ask for clarification. If your doctor uses medical terms you don't understand, ask them to explain in plain English. 4. Repeat back what you heard. Say something like, "So if I understand correctly, you want me to..." This ensures you've got it right. 5. Don't downplay symptoms. Tell your doctor everything, even if it seems minor or embarrassing. After your appointment. 1. Review your notes. Go over everything while it's fresh in your mind. 2. Fill prescriptions promptly. Don't delay starting new medications. 3. Schedule any recommended tests. Do this before you leave the office if possible. 4. Follow the plan. If your doctor recommended lifestyle changes or medication adjustments, follow through. 5. Set a reminder. Schedule your next appointment before you leave, or set a reminder to call and schedule it. Questions to ask your doctor. Here's a simple checklist to print and take to your appointment. What is my cardiovascular risk score for the next 10 years? Can you explain my latest test results in terms I can understand? What are my medication options, and what are the pros and cons? What specific lifestyle changes would help me most? What warning signs should I watch for? When should I call you versus going to the ER? When should I come back for a follow-up? Resources for additional support. The American Heart Association, heart.org, has excellent patient education materials. The CDC also provides free resources about heart disease prevention and management. Many hospitals offer cardiac rehabilitation programs that include education, exercise training, and support. If you're feeling overwhelmed, ask if your cardiologist's office has a nurse or patient educator who can spend extra time answering questions. Many practices offer this service. Let's recap the 5 smart questions you should ask your cardiologist. 1. What is my actual risk of having a heart attack or stroke in the next 10 years? 2. Can you explain my test results and what they mean for my daily life? 3. What are my medication options, and what are the pros and cons of each? 4. What lifestyle changes will have the biggest impact on my heart health? 5. What warning signs should I watch for, and when should I call you versus going to the emergency room? These questions will help you have better, more productive conversations with your cardiologist. They'll help you understand your condition, make informed decisions, and take control of your heart health. Remember, every person is different, and what works for one person may not be right for another. Always discuss any changes to your health routine with your doctor before making them. Your heart health is too important to leave to chance. Be an active partner in your care. Ask questions, speak up, take notes, follow through. If you found this helpful, please subscribe to Senior Vitality Clinic for more evidence-based health education. Hit that notification bell so you don't miss our next video. Take care of your heart. It's the only one you've got. This is Dr. James Wilson. Thanks for watching.